All right. Well, thank you to all of our viewers and all of our listeners here on today. Whether you are watching us via Facebook, on YouTube, or on Twitter, we just want to thank you so much for joining us here on today. And that's right, you have tuned in to Birmingham Bible Church's Winning Wednesday, where we like to decree and declare that we are all winners. And we also like to, of course, bring you different topics. And we've had some great topics all this year, all this month. And we want to help you walk out that victory, because that's what Winning Wednesday is all about, is helping you be victorious. We want to be victorious. Pastor Mason is great at helping us be victorious in our spiritual walk. And so we want to help you to be victorious in other areas of your life, via your finances, via your health. And so I am super excited about the conversation that we are going to have on today. All of you know it is summertime and it has been just hot. I don't think hot is even a word of what it has been. And I've always wanted someone to come on and talk about just how we can take care of our skin. It is a very important part of our body. Of course, it's the first thing a lot of people see when they first see us. It is our skin. And so I wanted to have someone on, and I'm so glad that I was able to connect with our guest speaker for today. Her name is Dr. Tiffany Mayo. She is with the University of Alabama here in Birmingham. I'm going to let her talk more about herself and introduce herself. But I'm excited because I know she's going to bring forth some great information. So viewers, this is what I need you to do. I need you to share this video with someone. I need you to, if you're watching on Facebook, I need you to tag some people, tag about 3 people who need to know about their skin, how to take care of the skin. And if you want to ask questions, that is available to you as well. I'll be looking out on Facebook and on YouTube, and you can put your questions in the comment section. And I know Dr. Tiffany will answer them as soon as she gets through with her presentation. And so I introduce to you Dr. Tiffany. Hey, Dr. Tiffany, how are you?
I'm doing well, and thank you for having me. I'm really excited to be able to just share some things that I know that can be helpful tips about the skin in the summer with you all. So thank you for inviting me.
Yes, I appreciate that. And, we may tackle, because I know we're talking about summertime, but a lot of people think, at least I used to think, well, I don't have to lotion myself that much in the winter. I'm like, no, yes, I do. I have to lotion because of that ash. And so I know the information you're going to bring. I know we're going to talk about summer, but, just overall, just even how we need to take care of our skin and just the importance of it. And so please introduce yourself. Tell us a little bit about yourself, what you do, where you work. I saw you also an assistant professor, maybe still at UAB. So yes, if
Yes.
you can talk about that, and then you can get into your presentation.
Okay, thank you. So yes, I am a dermatologist here in Birmingham, Alabama. My practice is at the University of Alabama at Birmingham. And in that role, because I'm in a medical center, I'm also an assistant professor, which means that I teach residents and help prepare them for training. I also teach medical students and help them learn more about the skin. And in that, I also, of course, always like to add a little bit about my background and my experience with them and help them understand how to better care for skin of color as well. And so I am an assistant professor. I'm also a dermatologist and see patients. That can be a little bit confusing when people look me up. I wear other hats. I'm the director of our clinical research unit. And so clinical trials is something that I'm very interested in and passionate about, helping the community understand more about what clinical trials are, how they can be helpful, and how they may differ from our perception of what clinical trials are and what it was in the past. I should also say I went to Tuskegee University for undergrad. And so understanding clinical trials in the context of our history in Alabama and in the South, really in the United States and all over is important. And so I like to contribute to what pharmaceutical companies, their perception may be, help them better understand the perspective of minorities as it relates to clinical trials. So those are a few of my roles. I'm very active with diversity in our department and UAB in general. So that's another role that I have here. And then I'd like to just end a little bit about me with, I have 3 children. I'm happily married, live here in Birmingham, but I'm from Utah, Alabama, so west of Tuscaloosa. So I am a native of Alabama and always happy to contribute back to the community.
Wow, you wear a lot of hats. That is a lot. But it just goes to show us and all our viewers that you're very well able to cover and tackle this topic. So thank you so much for your involvement actually in the community as well. So thank you for that.
So I'm going to share my screen here.
Okay.
All right, can you see that okay?
Yes, it's perfect.
All right, good. So I'll get started and then there will be ample time at the end to ask questions. So this is just an overview. And like Lady Pam said, we're going to talk about the basics of skincare management as well as how it relates to the summer. But really, skincare is all year round. You know, you should always be thinking about how to best care for your skin. And that's going to differ based on the differences, you know, we all have in our skin. Our skin type is different. I didn't add much about hair, but if you all have some questions about hair, hair loss is one of my areas of interest, and how to care for hair during the summer could definitely relate to this talk. And then there are some other conditions very specific to dermatology that may be more prevalent in minority communities, such as hidradenitis or recurrent boils that can occur under the arms in the groin area that we don't really talk a lot about, but it's very common. It can be exacerbated in the summer months. So those are just some of my other areas of interest that could align with this topic, and I'm happy to answer questions if you all have questions in the end. And then we will talk about some more common skin conditions that are directly affected by sunlight that I do want you to be a little bit more aware of, and there are some things you can do to help prevent flares during the summer. So let's just get started with the number one thing during the summer months is protection from the sun. And so sunscreen, you know, there are all of these thoughts out there about, you know, different skin types may not necessarily need sunscreen, but that's not true. So sunscreen is typically thought of for lighter skin, Caucasian skin, because there is a risk for skin cancer due to damage from the sun. And so sunscreen is very known in the white community. It's utilized not as often as we like, but more so for the protection from skin cancer. However, we love the sun. However, the rays from the sun can be damaging and can affect all skin types. So some of the things that it can cause, particularly in darker skin types, is darkening of the skin or hyperpigmentation. Now, that's something that a lot of patients are very concerned about. We do see it in adolescents, we see it in teenagers, and we see it in adults. And so hyperpigmentation can be worsened by the sun, uneven skin tone, that sort of thing can be worsened by the sun. The other thing is that some of the damaging rays from the sun can cause premature aging. Now, aging affects different skin types differently. So lighter skin types may get more kind of crepey skin, we call it, and wrinkled from the sun, but it certainly can affect darker skin types as well. And so sunscreen is going to be helpful to prevent that sort of damage from the sun. So there's a few things about sunscreen to know. If you haven't been using sunscreen, you should definitely use sunscreen. So SPF is what you're looking for, and to understand like how much protection are you getting from the sun. And SPF stands for sun protection factor. And so that's how long you can stay in the sun without burning your skin. So if a person typically would get a sunburn after being in the sun for 30 minutes, well, an SPF of 30 is going to give them supposedly 30 times more protection from getting a sunburn. And so that's how to interpret SPF. So darker skin types don't typically get sunburn, but you can get sunburn. So I have a lot of patients coming in and they're typically in their 40s or 30s, and they'll say, you know, I went to the beach and now I have all this sensitivity to my back and I got all this scaling skin on my back. What happened? And it's that I'm like, well, that's a sunburn. And they say, well, I never got sunburn when I was younger. Well, that's probably because you were out in the sun every day from the spring all the way through the summer. So your skin kind of got a little bit used to it, kind of got a little bit tan. But if you all of a sudden now we're indoors or at work, and then you go to the beach and you think you can handle the sun without sun protection, you probably should think again. So sunscreen can really go a long way to help protect us against some of the things that can be concerning. One of the largest issues with sunscreen and skin of color is that, you know, I think the manufacturers of sunscreen probably didn't have a lot of skin of color people on their teams when they developed the formulations, because they often can leave a white cast on darker skin types. And so that's not cosmetically acceptable. But thankfully, over the past couple of years, sunscreens have done a better job at blending better on darker skin types. And so I have no relationship with these companies, but I just included a few sunscreens that I often recommend to patients that do blend well on skin of color. And so they can help with your just overall skincare regimen. So when do you put on a sunscreen? In the mornings before you even go out. So I actually use this over here. You see it's Elta MD. It's a facial moisturizer with the sunscreen built into it. So I never go out without my sunscreen on. But you could, if you like your facial moisturizer in your regimen, then after you're done with your facial regimen, you would just apply the sunscreen as the final layer and then put your makeup on top of that. So there's various different ones. These are just some that I do know blend well on skin of color. Now, some people with sensitive skin may need something called a physical sunscreen. So there's chemical sunscreens and physical sunscreens. Those are the two main types. Chemical sunscreens usually have a better cosmetic appearance. They blend in better on skin of color. But for people who have a lot of contact dermatitis or sensitivity of their skin, they get a lot of itchy rashes to lotions and that sort of thing, they may want to choose a physical sunscreen. Physical sunscreen just has two main ingredients, zinc and titanium. They tend to be a little bit more difficult to blend in well, but the more pricey brands often do a better job at blending in well. So everyone can find a sunscreen that works for them, and I think is a very important part of the regimen all year round, but especially in the summer months. Another thing I'll get to right at the end is those skin conditions that are actually worsened by this rays from the sun, and sunscreen is going to be the number one treatment regimen when you're going to be interfacing with the sun. All right, so other forms of protection from the sun. So sun hats, you know, they're not just for style. They do look great in a stylish way, but they can also help protect you, protect your ears, protect the back of your neck, protect your scalp for, you know, those of us who some people thin, their hair thin, or especially for older men, they may be balding. And so this a hat would be very nice in terms of protecting you from the sun and adding a little bit of style as well. But to that note, there's also sun protective clothing. So a lot of patients say, well, I don't want to apply sunscreen, because another thing I didn't mention about sunscreen is that it doesn't protect you all day. If you're going to be out in the sun, you do have to reapply sunscreen about every 3 to 4 hours to get that continued level of protection. So that can be a bit much if you're wearing, especially a typical bathing suit where your arms and legs are exposed. So sun protective clothing can be helpful there. So this is clothing with UPF. So instead of SPF, this has UPF, or ultraviolet protection factor, and there will be a number. Typically it's like UPF 50, and it says that this fabric will protect you from the sun to this degree. And it's actually pretty lightweight. It's typically going to be long sleeved, and so some patients are pretty hesitant. They feel like they're going to be hot when they're more in the grass, but actually you feel a lot better because the sun isn't beaming down directly on your skin. And so actually my bathing suit, you know, my family laughs at me, but my bathing suit is long sleeve because I just, you know, I like that extra added protection from the sun. But you can get lighter shirts like fishing shirts, or if you go to a sporting goods store, they have a lot of varieties of different sun protective clothing that you can get. And if you don't get the clothing with the built-in UPF, so if you hold up your fabric, if you can see through it, then you're probably not getting as, the best protection from the sun. So different fabrics, so brighter colors, darker colors. Sometimes you can be a little bit hotter with those darker colors because they may absorb the heat, but they do protect you from the sun. And then loose fitting clothing is another good protection, because when you stretch that clothing, you're not getting as much protection, but also it's not really that comfortable to wear tight fitting clothing in the summer. So these are just a few ways that you can protect yourself physically from the sun. All right, so now let's move on to what our daily routine may involve in the summer. So bathing. So we have a huge problem with overbathing. People tell me, "Oh no, I bathe 2 or 3 times a day. Every time, I get sweaty, I feel like I need to take a bath." Well, that is too much bathing. Okay, so once a day is what's recommended, unless you have a job where there's chemicals and debris getting on you, then that's understandable. Or especially for teenagers, if they're playing a lot of sports and they actually are getting sweaty and grimy, they may want to take a shower, but you don't need to overuse the soap. So as we get older, our body actually doesn't make as much moisture as it did in the past, and so the more soap we use, the more moisture you're wiping away. So your skin is more prone to getting dry, to looking flaky or ashy. And so you don't want to overbathe. And so I typically tell patients, use soap, but use it sparingly. If you're not getting dirty per se, then just use soap in the areas that matter the most and let the water rinse the other areas, especially if you're taking multiple showers a day. Also, try not to have the water so hot. Some of us just love our hot showers. That's typically not as big of a deal in the summer as it is in the winter, but extra hot water also is going to dry the skin out, make it look more kind of crepey, make it look more ashy and dull. And so you don't want to use water that's too hot when you take your bath. And then, it's okay to take a bath, but try not to stay in there too long. You don't want to be taking all of the great things out of your skin. You just want to be removing the things like the dirt, grime, sweat, that sort of thing that doesn't belong there. So go easy on the soap and try to bathe no more frequently than once daily if needed. The next thing is moisturize. Oh, go ahead. Yeah.
No, listen, no, you stepped on my toes on that one, because I'm known for taking hot showers and long hot showers.
I know, they're relaxing. They're
so
relaxing. They're relaxing. So if you're one of those people that really need your hot shower, then don't do it every day. Like pick your day.
Okay.
Pick your day, and that's going to be your one day. And within 3 minutes of getting out of that shower, you need to be lathering up with a nice moisturizer that's going to replenish what you just took out of your skin.
Yes, ma'am.
So, well, that's a good segue into moisturizers. So everyone needs moisturizers every single day, whether it's summer, whether it's winter, you need a moisturizer. You can choose lighter moisturizers in the summer months, but you still want to have the main ingredients. So when we think about moisturizers, there's lotions, there's creams, and then there's emollients, more like petroleum or something that's heavier, and ointments is what we call it. So, I mean, I love Vaseline. Okay. I grew up with Vaseline, love Vaseline, and that would be more of an ointment. And what that does is, so when you get out of the shower, within 3 minutes of like getting out of the shower, you really want to be putting on whatever your moisturizer of choice is to lock that moisture in and kind of get you ready, for your day to hold in that moisture. Sometimes that sort of thing can be just a little too much for the summer. So in the summer, I typically switch over to something that's still moisturizing, but a little bit lighter, like CeraVe Daily Moisturizing Lotion, or Cetaphil, or La Roche-Posay is another brand that I like, because because it's not as irritating. It's not as hot for the summer months. And so, but you do still need a moisturizer to just keep your barrier, the skin barrier intact, especially for people with sensitive skin and eczema. You are always going to need, after every shower, put a moisturizer on. Once or twice a day. Moisturizing can be very helpful and do wonders for your skin.
Dr. Tiffany, I had a quick question. Is there any type of moisturizer that's like too heavy? I've been told that certain ones can clog your skin pores.
That's absolutely true. So even though I'm a lover of Vaseline, I never put it on my face. There is, some, like there's been like a recent fad with slugging. I'm not against slugging if you're someone who's not acne prone. What that is some people will put their products on their face, then they'll put Vaseline on top of it. Well, Vaseline does occlude the pores. This doesn't tend to be a big deal for some people who just never had problems with acne, but I cringe when my patients tell me, yeah, I put Vaseline on my face, because it's definitely going to be blocking the pores. What you want to look for is a moisturizer that says, and it's a long word, we need to come up with a more patient-friendly word for this, but it's going to say non-comedogenic. That's because a comedone is a blocked pore, like a blackhead or a whitehead. And so let's see if you can see it on Sarah. Like most of the time, somewhere on the front of the bottle, it'll say non-comedogenic, which means it doesn't block the pores. So even though it's a great moisturizer, it's a lotion form, that's fine. As long as it says non-comedogenic, it won't block the pores. So yeah, someone who's acne prone, especially people who get back acne, then I would lay off of the occlusive moisturizers and get the ones like CeraVe, Cetaphil, Vanicream is another one that I like. Those, even though they're very moisturizing, they don't block the pores. So things can be moisturizing without being heavy. So it's all in the ingredients, not necessarily how it feels like when you touch it. So something can be a barrier like a petroleum jelly or Vaseline or Aquaphor, but that doesn't mean it's adding anything, to your skin that's going to help it draw in moisture. But there are some moisturizers that their ingredients actually help retain moisture and draw it in a chemistry related way. And so they may be very light, but they actually are really good moisturizers. And so the ones that we typically recommend are going to be the ones that are not irritating. We do not like fragrances in dermatology because they can be so irritating and just a low enough grade irritant that patients don't recognize it, but they're always itchy, or they always have these type of skin rashes. And so the ones we like to recommend are going to be CeraVe, Cetaphil, Eucerin, those sorts of ones that you can find easily over the counter in a drugstore and a supermarket. So those also are ones that don't clog the pores, and so they can be used on the face. And then finally, staying dry. So just, there's a lot of controversy about powders, especially those talc powders. There's been lawsuits about cervical cancer. Any powder, I would say, is meant for external use. And there's some non-talc powders. Some people still use talc powder, but I just want to put that out there that, this is controversial in literature, and whether or not it's directly linked to cervical cancer, but that has been reported. But some people they get wet and body folds, or just friction, or just it's difficult to stay dry. They may sweat a lot more than others, and we call that hyperhidrosis. Now, you should see a dermatologist if you feel like you sweat excessively, the palms, the soles, under the arms, or on your face, and there's treatments for that. But if you feel like it's just a typical sweat, or it's just a specific area, then you can use some powders, your preference, whatever you're comfortable with, as long as it's external use, to help with the wetness. There's also kind of wicking type fabrics. A lot of the sports brands like Nike make some of those wicking fabrics. But some powders, especially for instance, in females under the breast or under the folds of skin, for males and females, Zeazorb is a powder that we often recommend in dermatology. It's called Zeazorb AF, which stands for antifungal, because yeast just loves warm, moist areas. And so if you're constantly getting a rash, like under the arms or under the breast or under any body fold, then you can use a powder like this and it'll help the area stay dry. Also, good old diaper rash cream is a zinc-based cream that can help you stay dry. And then also cornstarch is also helpful with staying dry. So these are just some things that you can do in the summer months, but also really throughout the year, especially with the bathing regimen and the moisturizing. Those are things that are going to be really important. And I'll just expand on what I mentioned. I'm going to just check the time here. Yeah, okay. I'll just expand on what I mentioned about fragrances. You know, everyone loves to smell good, but we see more problems from fragrances in daily products, you know, than you'd imagine. So your soap, you know, we definitely recommend a sensitive skin bar soap. And we say bar because people tend to use too much like shower gel. They just overuse it. And so a bar soap sometimes can help you keep track of just how much soap you're using, but something, you know, made for sensitive skin, meaning it's not going to have fragrance in it. Also your laundry detergent. Everyone loves to smell like a, you know, I don't know, a winter breeze or whatever. But those fragrances in the laundry detergent and in the dryer sheets are deposited on the clothing, which is why they smell so good. But if you have a sensitivity to that, then that's going to be rubbing up against you all day in your clothing, all night in your sheets, and you just can't get rid of whatever the dermatitis or the itch is that you have because you're not recognizing that it's in something that's having exposure to your skin every day. So just be mindful, you know, of that. If you're not having any problems, then you can smell like strawberries or, you know, whatever it is that you like to smell like. But for some people, if you're having issues with a lot of skin rashes, especially itchy skin rashes, it can be due to fragrances. And so think about your soap, your moisturizers, your laundry products, that sort of thing. All right, so now I'm going to talk just a little bit on skin conditions that can be worsened by the sun, and then we will open up to questions here. So lupus is very common. It affects, you know, all races, but it's especially common in skin of color. And so this up here, if you all can see my cursor, you know, these are just some images of what lupus can look like. This is called discoid lupus, but really lupus can look like multiple things, or it may not have skin involvement. Discoid lupus just happens to be the lupus that's just limited to the skin usually. But you know, it can occur in the scalp and cause hair loss. It can occur on the face and cause red areas that leave scars behind. And especially when we see like dark areas in the ear, we call that the concha bowl of the ear. That's especially a telltale sign of skin lupus. It's so common and it's often, you know, missed by patients. They think it's just a rash. But for patients who do have lupus, the sun will certainly flare your lupus. And this is a problem, especially in skin of color, when we're not necessarily used to using a sunscreen. Once these areas occur on the face, they do leave scars. You can see this, this young lady here has multiple scars on her face, and that's from lupus. The singer, what's his name? Seal, the scars on his face, that's from lupus. And so sun protection, all, you know, protective hats, that sort of thing can help prevent some of that. But honestly, if, you know, if a patient has lupus or discoid lupus, they also need to be following with a physician. But protection from the sun is going to be very, very important. Another common skin condition seen in all races and ethnicities is going to be melasma. So melasma is darkening of the skin. So this is a picture of melasma. It occurs symmetrically, meaning usually on both sides of the face or chin or upper lip. And it looks, you know, kind of, we call it the mask of pregnancy because it's associated with hormones, and a lot of women do develop it after starting birth control or after pregnancy, or they just get it. You know, men men get this as well. And so it's called melasma. It's not known to affect anything else, but it really bothers patients to have this darkening, on their face, this uneven skin tone. We know this is worsened by the sun. It is absolutely directly worsened by the sun. So seeing a dermatologist can help lighten this, but there's no cure for it. So for instance, there are several patients I'll treat with chemical peels and skin lightening creams, and then they'll, kind of get somewhat back to baseline, and then they go to the beach or go to a baseball game, and within a few weeks, it's right back. So the sun has a direct correlation with worsening of melasma, and so sunscreen, those sun protective techniques that we mentioned can be really helpful here. Rosacea. So rosacea, this is a little image of rosacea. It can look very similar to acne, but if you're a grown-up and you haven't had acne in years, and all of a sudden you're getting a lot of acne, especially on the cheeks, and it's not blackheads and whiteheads, it's more like little pus bumps, and you can see pinkness, then that's probably more than likely it's rosacea. Rosacea, a lot of people think, oh, Black people don't get rosacea. Well, we get it. You just probably don't know that that's what it is. And so this has specific treatments, and we know it's worsened by the sun. And so, if you or someone who is experiencing any of these skin conditions, they should see a dermatologist. But also, even if they don't have to see me, they can see anyone, but they should also know the importance of sun protection, because a lot of physicians may just assume that everyone puts sunscreen on, or everyone knows that they should be wearing sunscreen. And so this may be just a little thing you can remind people of if you know someone with these conditions. And then the final one, actually eczema. I included eczema on here because eczema is a type of dermatitis or irritation, inflammation of the skin that is very common. It causes itchiness. It can be very uncomfortable to patients. So anything that itches is worse in the summer, if you ask me. And so really using some of those clothing that help cool the skin, using hats and that sort of thing, loose fitting clothing, that can be really helpful for patients who have eczema in the summer. And then finally, heat rash. We say heat rash. I mean, patients will come in and say, I have heat rash, and it clearly is something way more severe than heat rash. But in general, heat rash is a rash that gets worse in the sun. And the typical, classic heat rash is something that we call polymorphous light eruption in dermatology, or PMLE. And that's these little fine bumps that patients get on their arms or on their backs. And, when I became a dermatologist, we're going over these things, and they're like, oh yeah, PMLE. And I look at them like, oh no, that's heat rash. I know what that is. That's from the sun. And the truth is that it is from the sun. People often get it more right when it starts to get warm, because their skin hasn't been used to sunlight, but then it gets better over the summer, the more their skin gets used to it. But this really can be a problem, for some patients. And so if it's a problem, sunscreen can help, and they can also see a dermatologist to help them with it. But any rash that someone notices that's worse, like on the face or the sun exposed area of the chest or the back of the hands, they really could have a condition that makes them more sensitive to the sun. So it's worth seeing a dermatologist to get the appropriate diagnosis and treatment. So that is my talk, but I'm definitely happy to answer any questions that you all may have.
Oh, thank you, Dr. Tiffany. That was so informative. All the information was great. I've learned a lot just looking at your slides and listening to the presentation. Someone had a question about products for men, and then I had a question about products for children. Once you tackle the question about the men, when you get ready to discuss the children, what's a good age to start teaching our girls, our boys about, hey, use a cleanser, a toner, here's the moisturizer. Usually, because we had boys and they were always in sports, I was like, as soon as you play in sports, because you got to wash your face, they're wearing helmets and they're sweating. But if you could talk about questions for, the men, just what kind of products they be using, and then children.
Okay. So
Yes.
men honestly should use some of the same products as women.
Oh gosh.
I think, you know,
They could be all in that stuff. That'll tell.
oh, I know. I was luckily, hopefully, y'all don't know my husband. If y'all know my husband, don't tell him I said this. But we were out of town and he ended up, you know, I brought all of my stuff and then I let him use it. He goes, "You've been holding back on me. Why hadn't you been letting me use this stuff all along?" so so I do, you know, our skin is different, but it can be very similar. So there are some products, especially that just for like an anti-aging or very nice, you know, skincare regimen, for instance. In the morning, a gentle cleanser that would be applicable for everyone. And then a sunscreen or a moisturizer with a sunscreen built into it. That's applicable for everyone, you know, all skin types. In the evening, a retinol or a retinoid. So that would be something like, you know, Olay makes a lot of products with retinols over the counter. There's a more stronger version of retinoids that we prescribe in dermatology called tretinoin is the generic name, or Retin-A is the brand name. But we love retinoids in dermatology, and they can be helpful for all skin types, men and women. And you can get some gentle ones over the counter. But the way that they work is they help increase the cell turnover, so they get rid of dead skin cells. So this helps with acne. It helps unclog pores. So kids, adults, you know, who still get blackheads, it can be very helpful for that type of acne. It's actually probably one of the most beneficial things. It helps even out the skin tone because it's getting rid of dead skin cells faster. So all those conditions that I mentioned earlier with skin tone, you know, those patients, I'm going to be putting on a retinoid. But it also gives you that glow. So when you see people and you're like, oh my gosh, I mean, your skin looks so nicely exfoliated, you know, they're probably using a retinoid. But particularly for men, and not just for men, because hirsutism or excess hair growth on the face is also a problem for women, especially ethnic women. And so for the hair bearing area, it can help smooth that skin, help even out the skin tone, help with the texture of the skin. So a retinoid or a retinol, it can be very helpful, but they don't, you know, they don't target in male type products this as often. And so, you know, I personally, you know, think it can be very beneficial. So when patients come in to see me for razor bumps and that sort of thing, or they just come in and they want a regimen. Typically a retinoid is going to be a part of that regimen. So if I had to pick two things, it would be a sunscreen and a retinoid to add to the regimen. And you can get retinoids over the counter, like the retinols are going to be more gentle, and they're typically going to be marketed as nighttime, you know, creams, and you'll see in the active ingredient, it'll have some form of retinol. Or different acne gel is one of my favorites over the counter because it used to be a prescription, but now you can get it over the counter. And even though it says it's for acne, you can use it. Now they can be a little bit irritating because they do exfoliate the skin. And so you may get a little bit of scaling when you first start using it. You shouldn't use these types of products on your eyelids or your neck because that skin is way more sensitive than your face skin, believe it or not. And so starting off a product like that every other day or a few times a week can be helpful. And then also with products, it's important to know not to overdo it. Like you shouldn't be, so your nice product, you should not be like slathering it in your hand, wasting it on your hand, rubbing it around. Your hands will be great, but it won't get anywhere else. So really just a pea-sized amount, and then you're dotting it on your face, and then you're rubbing it, you know, in. So that is a better way to use the product and not waste those types of products. Now
And you
for
said,
kids, oh, go
and you
ahead.
said for all of, you said all of Olay has a good one.
Yeah, oil of Olay is,
Okay.
you know, they have retinols.
Retinol.
There's several
Okay.
brands over the counter with retinols. La Roche-Posay has retinols. And so you can go in down the beauty aisle, or you
Yeah.
can Google, you know, and just look up, you know, best retinols. You'll see tons that are available over the counter. And so you can try them out and see what you think. But the different
Okay.
acne gel is a little bit of a stronger one over the counter, and it can be very helpful and easy to find too.
Okay. All right. Okay. And then
And
for the
then
children.
I think that, yeah, the second part was
Yeah.
children. So with kids, again, sunscreen is going to always be applicable. And so sunscreen is good for everyone, especially if they're in daycare or in school and they're spending a lot of time out in the sun in the summer months, especially sunscreen can be helpful. But a regimen. So it depends. So I typically say, kind of starting around puberty is when the skin starts to become more acne prone, and you really want to focus the products that they're using to things that are meant for that location. So they probably shouldn't be used unless it's one of those moisturizers like Cetaphil or CeraVe that's non-comedogenic and doesn't block pores. They shouldn't be using like, I don't want to call a particular brand because there's no brand that's horrible, but just things that are should be used in different areas. So if they're using it for their legs, and it's not necessarily meant for the face, you may want to get one that's more meant for the face. So as a gentle wash, so we dermatologists, we actually like to keep things pretty simple. So, you don't necessarily need something, with, exfoliating beads in it and something, and a toner and then witch hazel. And then like, you don't need all these things. So
Okay.
you need a gentle cleanser. And then you let the product ingredients do what they're supposed to do. Because if you do too much, you're going to just get irritated and not do any of it. So a gentle cleanser. So something that's meant for the face. Again, I have nothing to do with these products, but they're easy to find and they're not that expensive and they're gentle and good for all skin types. But like Cetaphil, the CeraVe gentle foaming facial washes. So foaming facial washes can be good because they help get makeup off, especially for teenagers and that sort of thing. And they're good for guys, as well. So a gentle foaming facial wash like Cetaphil or CeraVe. And then a moisturizer with the sunscreen built into it that's meant for the face. So any moisturizer that's meant for the face. And if they do have acne, there's medications that dermatologists will typically prescribe for the morning that may be like a topical antibiotic or an anti-acne wash like benzoyl peroxide wash that's over the counter. So the wash just depends on whether they have acne or not. So if they have acne, there's benzoyl peroxide wash. Panoxyl is one. CeraVe makes a benzoyl peroxide wash now. And then if they don't have acne, just something gentle like one of the washes I mentioned, Cetaphil or CeraVe, and then they're moisturized with sunscreen. And then in the nighttime, it's the same, just that same gentle facial wash. They could use something like Dove soap because it's pretty gentle as well, and a moisturizer that doesn't have sunscreen in it. So if they're using something that they want just one thing for the body, and that's good for the face, the Cetaphil, the CeraVe, those are going to be a pretty good option. But if they do have acne, the retinoid, we use retinoids in teenagers as well. So adolescents, teenagers, as soon as they become acne prone and starting to get acne or hyperpigmentation, dark spots, we start using the retinoids. And so we could prescribe it, or there's a few they can try over the counter. I will say with the retinoids for my child potential bearing females, you don't want to use retinoids or retinols or anything like that in pregnancy because those can potentially be absorbed in the skin and can cause problems with pregnancy, even though they're over the counter, or they may be sold by some of the brands that have a line. You don't want to use retinoids in pregnancy. You want to stop those then, but there's other things that you can use instead.
Okay. And then somebody had a question about boils. You talked about that a little bit under the arms. What is good for that?
Boils. Okay.
Yeah,
So
boils.
one, if someone is getting recurrent boils, it may be a condition, an inflammatory skin condition called hidradenitis suppurativa, or HS is what we call it. And they should definitely be seeing a dermatologist. But people can get boils like one here or there a few times a year. It's not necessarily recurrent. It's not in the same place. And that could just be a boil. So with boils, it depends. A lot of times, so it's just an inflamed hair follicle that got very inflamed or pus collected, or sometimes there may be a little block pore or a cyst underneath there and it got inflamed. So typically drainage helps them feel better, right? But I don't want you like going getting some pin, sticking it in there that so try to encourage drainage with warm compresses first, where you're kind of opening up everything, bringing it to the surface, allowing it to drain. Squeezing can make some things go deeper into the skin. And so excessive squeezing is never going to be recommended by your dermatologist, but more of the warm compress and that sort of thing. And if it comes to a head and drain, fantastic. If it doesn't and you're in a lot of pain, you may want to see, it may be easier to get in with a primary doctor for an actual incision and drainage, and that's where they just open it up a little bit in a sterile way and allow it to drain. But if it is truly the condition hidradenitis, we don't like incision and drainages. We like the patients to come in and get the appropriate treatment, because there's actually medical management for the inflammatory pathways that lead to the recurrence of those hidradenitis lesions. But warm compresses, antibacterial washes like dial soap, can be helpful for people who are getting boils, kind of randomly here and there. And then bleach baths. Now, hear me out. We're not trying to bleach anybody's skin here with bleach baths, but it really is just to get the surface bacteria off of the skin. So once a week bleach baths can be helpful, for instance, for people who get boils, for people who get eczema flares, just to get that surface bacteria off. And what you do is you fill a tub with water, and it's really just a cap full of plain cheapo bleach, not the new concentrated stuff, just the plain bleach, just a cap full. And you're creating kind of like a swimming pool would be, where you're just getting that surface bacteria off, but not causing any irritation to the skin.
Good. Okay. Awesome. Thank you so much for that. And that was a question I had about witch hazel, but I'm glad you said, keep it simple, just a cleanser. And I thought about that because, I probably do too much. I got the cleanser, I got the witch hazel, then I got eye cream, and then I got a moisturizer. So I'm probably doing too much.
I do love a good eye cream. I love a good eye cream. But I think, for instance, if you're using a retinol and witch hazel, then your skin may be too dry. So I think picking the thing that has the best ingredient to actually do something to your skin, and then leaving off the things that are just going to irritate the regimen that you actually have, is a good way to approach your skin management. So if someone loves a witch hazel or a toner and they feel like it's working for them and they're very, very oily and they like it, then fine. But if it's causing irritation, I'd rather patients stick to the things that are going to help improve the skin overall.
Okay, awesome. Well, thank you so much, Dr. Tiffany. We all appreciate the information that you gave us here on today. I'm going to do a couple of announcements just to kind of tell people what's coming up. But when we come back, I want you to tell people how they can contact you. And how they can set up an appointment, website, phone number, all that good stuff. Everyone, don't forget, of course, we won't have small groups this week due to our small marriage and singles retreat. It's going to be this weekend in Atlanta, so no small groups for on Saturday. Don't forget about our worship service celebration. We'll be virtual on Sunday. However, we will be in person the first and third Sunday in July. So first and third Sunday in July, we will be in person. We will see you virtually on Sunday. Pastor Mason, don't forget, he is continuing the series summer in the Psalms and times when COVID seems to be ramping up again. So in the midst of that series. Also, we're on One Place. Don't forget that, oneplace.com. If you want to listen to Pastor Mason on the go, receive great, encouraging, inspirational messages, go to oneplace.com and do a search for his name, Dr. James H. Mason. The third. So that's it. Listen, I know, Dr. Tiff, that we talk about the outside, and we all know that what you put on the inside is a reflection of what you do on the outside. So this is not to take away, guys. Y'all staying hydrated and drinking your water and eating all those healthy foods. It's not to take away from that. That is just to enhance what you're doing already on the outside. And so, Dr. Tiff, how can people contact you? And also, if you can give us any final words on just how we can continue to take care of our skin.
Okay. Yes. So I am at the University of Alabama at Birmingham, or UAB Whitaker Clinic, Whitaker. So if you search UAB dermatology, you'll find me there as well. And so our office number is 205-996-7546 or 205-996-SKIN, and you can make an appointment to see me there. I'd love to see you. My wait list is a little bit long. I have several colleagues that I do work with. And so any of us honestly would be very, very happy to see you. In terms of final words, I think, the skin, like you mentioned earlier, people can see our skin, but the skin is also reflective of several things kind of internally. So like you mentioned, the types of things we eat, the types of things, how often are we staying hydrated? How are we feeling about ourselves? Because that kind of ties into what type of energy and commitment we're putting into what we're eating, drinking, and what we're doing to our skin. So let your skin reflect your best you. That means by behaving and acting like your best you. Anything that you're expecting to be its best is going to require you to act accordingly. And so really, just try your best. And if you're having issues with your skin, don't hesitate to seek the care of a dermatologist. There are several things that we can do to help patients manage their skins. And there are several conditions that people have that they don't come in and get treatment for because they don't realize that they're treatments, or they don't realize they should see a dermatologist for it. So any condition related to the hair, the skin, the nails, even if you think it's, oh, this runs in my family, or I see this all the time, you should see a doctor and let them decide and help you decide what your next steps should be.
Yeah. Thank you so much, Dr. Tiffany. And I forgot, she did mention at the beginning that she also talks about the hair and taking care of it. And you're so right. Great information. Thank you so much. We're going to try to get in to see you as well. I guess we better call now so we can get in a little bit later. But yeah, I do remember the bleach baths because one of my children have eczema and they recommended that. And so I was like, what? But listen, guys, listen, all those homemade remedies grandmama and big mama used to use, may not work now. So let's go in, let's make sure we get an appointment with Dr. Tiff and do some other things that can help us with that skin. Thank you so much, Dr. Tiff. Y'all listen, make sure you contact her. She's at UAB at the Whitaker Clinic. That number is 996-7546. In other words, skin. Got it. Yes, ma'am. Thank you so much, everyone. Listen, have a great day. Stay safe, be safe, stay hydrated, and just continue to protect yourself. Thank you so much, guys. Have a great rest of your Wednesday. Bye, Dr. Tiff.
Bye.
Bye-bye.